Dr. Austin here. We're going to cover the best position to sleep if you have anterior pelvic tilt. Now, anterior pelvic tilt is typically due to the forward tilting of our pelvis, which can cause a lordosis type posture in our lumbar spine, which can cause tightening of our erector spinae muscles in our low back. Anterior pelvic tilt can be due to multiple different things. It can be due to weak abdominal muscles and weak glute muscles. It can be due to shortening or tightening of your erector spinae muscles, which is those muscles in your low back near your lumbar spine. And it can also be due to tight hip flexors from sitting for long periods of time throughout the day. Now, when we have anterior pelvic tilt, it's an increased lordosis posture, which can cause tightening of that erector spinae, like we just said, which can cause spasming as well and be really uncomfortable, especially if we're trying to find a comfortable position to sleep during the night. So what we really want to do when we have anterior pelvic tilt is, instead of having that shortened posture of those erector spinae muscles being short and possibly spasming, we want to elongate those muscles and allow them to be able to relax, be lengthened a little bit, and allow us to be able to find a comfortable position to sleep in during the night so we get a complete night's sleep. And this is how we're going to do it. If you're finding value from this content, consider leaving a tip of coffee. It really helps support the channel. So first, if you're a back sleeper and you have anterior pelvic tilt, your posture is going to be, I'm going to exaggerate a little bit, but it's going to be a little bit like this. There's going to be a gap in your low back when you're sleeping, causing shortening of those muscles, the erector spinae muscle. So what we want to do is lengthen this area in our low back, and we can allow it to be lengthened, relaxed, and be in that position for a long time throughout the night. So a good way to do that is to stack a pillow underneath your knees, and you can stack 1, 2, 3 pillows, however many you need to be able to flatten out your low back area. And then that way you have a passive low back flattened posterior pelvic tilt position that you can sleep in throughout the night, and you can find a relaxed position. You can sustain this throughout the night, and it'll allow you to get some sleep. And if you're a side sleeper, what you can try is you can try just laying on your side and bringing your knees up to your chest. So you'll just kind of sleep in this position here. And by bringing our knees up to our chest, having that knee bend, that'll help flatten out our low back as well, elongate those muscles, and allow a comfortable position to sleep during the night. You can also take a pillow and you can put it between your knees for a little bit more comfort, or you can hug it as well, like a body pillow, something of that sort. Next, if you're a stomach sleeper, which I don't recommend for multiple reasons, but we'll get into that in another video, you can try this position. So you'll lay on your stomach and you'll put this pillow just above your hip bones, and that's going to help flatten out the erector spinae, loosen that area up a little bit. And if you're experiencing shoulder pain from sleeping, let's head over to this video and I'll see you over there.